Hey friends, welcome to A Mental Moment. This is Donovan Frederickson with Texas Mental Health Resources, and I'm excited today to be visiting with Christina Runnels, the founder, the president of Greater Houston Counseling Services. Welcome to the studio, Christina.
Thank you, Donovan. I'm excited to be here.
Well, we're excited to be here as well. Why don't we start off by telling me a little bit about yourself, about what led you to start Greater Houston Counseling Services. How long ago was that?
So that was actually 13 years ago.
Wow.
Yes. And so in terms of how we've been operating now in our locations, it's been about 10 years. We opened our very first commercial property that we were at providing services in Spring, which was our very first location. That was about 10 years ago.
Wow. So, and you have how many?
Four.
Four locations.
Yep, 4. Okay.
And a little bit later in the broadcast here, we'll have her share some of those, the contact information or the locations. So tell us a little bit about what kind of services that you provide those people who are suffering from mental health challenges.
Yeah, so we consider ourselves kind of an all-encompassing full-stop facility agency. We provide medication management. So we do have nurse practitioners on staff that do medication evaluations and ongoing follow-up appointments. We also provide psychotherapy, and we do that for individuals, couples, families. We also offer groups, and then we do summer camps too.
Wow.
Yeah. So we're actually in our second one this summer. We've got one more at our Katy office. So we do all of those things.
Wow.
And we have a psychologist on staff as well, and she provides psychological evaluations. So it kind of runs the gamut between testing, psychotherapy, and medication management.
Okay, great. What kind of age range? I mean, do you handle teenagers, children, adults?
Yeah, so we see kiddos as young as 3.
Wow.
We do have play therapists on staff, and all of our offices are now equipped with playrooms.
Wow.
So we provide that, and then we go up through the lifespan.
Okay, wow, that's really helpful. Talk to us for just a minute about the intake process. I know that some people are concerned about that. What does it really look like for people who might be interested in counseling, but they really don't even know where to start with that?
Yeah. So the intake process can feel scary, especially when there's so many options and trying to figure out what's the right option. For us, we try to streamline it as much as we can. So we have a few ways you can get in touch with us. We have, of course, a phone number that you can call. We have a text-in number that you can reach out to start the process. And then we also have online forms on our website. So if you were to go to our website, you would just go to that page and you would click the form, and it's going to ask you just some very general information like demographics and email address, and then it will actually email you paperwork to start the intake process.
Great.
And then from there, all of that gets translated to our client care team, and then they do that follow-up once we get that initial intake inquiry.
Perfect. That's great. And like I said, in just a little bit, we'll have you share your website and some of that information for people so that they can write that down if they want to. So are you accepting new clients, I'm assuming now?
We are. Our team, I laugh because we are growing by the minute, it feels like, but I think we're probably at a team of about 45 therapists. And so we are... Either if we're not accepting, we're growing so that we can continue.
That's awesome.
Yeah.
Wow, that's great. So do you process insurance? I know some people are really concerned about, and I've seen some that don't process insurance.
Right.
Do you do that?
We do.
Okay.
So we're in network with most major insurers, Aetna, Cigna, United Healthcare, TriWest, Blue Cross Blue Shield. There's a lot of third-party insurers, and sometimes they fall under those umbrellas and sometimes they don't. So I really encourage people, if you're not 100% sure, to just, check it out and see. It may still fall under Blue Cross, but look like something very different.
Sure. And I know that we were talking a little earlier, and you said something about that in some circumstances you do handle sliding scale payment from individuals. So we certainly, I know at Texas Mental Health Resources, we don't want someone not getting the care they need simply because they can't afford that. And I know that's your heart as well.
It is.
And that's one thing, like I was sharing with you, that's one thing that we do at TXMHR is help to provide some of those resources. So as we partner with with Greater Houston, I would love for us to make sure that people in the Houston area are able to get the care that they need. And
so we have various levels of clinicians. So we do have doctoral and master level clinicians. We have fully licensed, associate level, and then we also have practicum student level clinicians. And so those folks are still in their graduate programs, and as a part of that program, they're required to do a certain amount of hours under supervision. And what's neat is we're oftentimes able to utilize them to really help us kind of support the folks that maybe wouldn't be able to otherwise afford services.
Great. That's great. It's great for clients. It's also great for those students.
Yes.
What a great opportunity to get those hours that they need in order to finish their programs. I know you said that you have a robust veterans treatment program, and wow, that is so, I can't even describe how necessary that is now to be able to serve our veterans. And so why don't you tell us a little bit about that?
Yeah, sure. So my husband's actually a veteran himself. And so we know, and kind of having navigated the mental health system and just, the VA system, that sometimes it can be difficult. And so the VA has pretty much created a program themselves called the Community Care Department. And they work with outside providers to provide community care services. And so we are one of the community care providers that does work with them. And essentially they send us a referral for services with an authorization. They're very, very generous with the amount of sessions that they allow. They're really wanting to support the veteran. And so we pretty much have developed an entire department dedicated to just serving our veterans.
That is awesome. So if we have any veterans that are listening right now, what would they do? Do they need to go to the Veterans Administration? How do they start that process?
Yeah, so they would need to go to the VA, because those referrals do come directly from the VA. Unfortunately, we can't generate them. My understanding on their side is that they speak with either their primary care physician or their psychiatrist at the VA and tell them that they're needing the services, and then they can assist them in getting that referral.
Okay, perfect. Wow, that is incredible. You have such great services here. I'm really impressed with that. And so if you were speaking to someone right now, who, and I know you do that all the time. You're a counselor yourself as well.
I am. Yep.
And so you have an opportunity to visit with people who are struggling with mental health challenges. If you were talking to someone right now, what words of advice or encouragement might you give to them?
Yeah, I think one thing that I often share is, you're going to hit challenges in places where maybe you think you won't be able to find services, or you start and your insurance changes, and really just try to continue, try to keep pushing. It's becoming easier to find ways to provide mental health care services. I know we're one of the agencies that does take insurance, and some do and some don't, but using insurance is becoming a lot more standard too. So there are options. Don't give up. If you hit a roadblock, definitely keep looking through and finding options.
Great. Yeah, that's a great word of advice. I know our tagline for TXMHR is providing support, fostering hope. And hope is what's important, right?
Absolutely.
Don't give, like you said, don't give up.
Right.
There is hope.
Right.
And so we will partner together and try to find a way for you to get into a better place with your mental health, right?
Awesome. Yeah.
So there are a number of people. You meet with individuals who are struggling with their mental health.
Right.
What about caregivers to them? That is a really important area, right? And so you said that you meet with couples. Do you meet also, I'm assuming, with people who are struggling and with their spouses, with their whatever, whoever their caregiver might be?
Yes. Of course, it depends on the dynamic and our eligibility to speak with that person. But especially when it comes to serving children and helping them with their mental health needs, it's often very, very tied to the parents and making sure, or the caregivers, and making sure that they are supported too, and that they're aware of how to manage the needs. And so I think that we don't do anything anything by ourselves. We really don't.
No, we don't.
We don't. And we need our other person, be that our caregiver or our partner or whatever that might look like, to make sure that we're all kind of moving in the same direction and getting to where we need to go. And so it's always important to us that if we're able to, that we give out that information too.
Okay, perfect. Yeah. And so what might we say to caregivers? I mean, I know for ourselves, I mean, people who are listening to us, most of them know that our own situation. My wife has bipolar disorder, has been for over 20 years. And I've been the one, I hate even using the term caregiver, but the one that's been there walking that road through the road with her.
Right.
And so that person needs support as well.
Absolutely.
And so what might we say to that person, the person who is with someone who needs help, maybe isn't getting the help that they need?
Yeah.
What encouragement might we give to them?
So I think one thing to keep in mind is, it's kind of become a tagline, but you can't pour from an empty cup. So we have to keep filling our cup for ourselves, and we have to keep ensuring that if that dynamic is important for us, that we're able to give ourselves what we need so that we can be of service to other people.
Yeah, exactly.
It's really important.
Exactly true. And for them as well, that there is hope. Sometimes it feels like that you're in it kind of by yourself. And so hopefully we're able to take away some of the stigma, to help educate other people as well. So to come alongside that main caregiver.
Right.
Come alongside them, help them to walk the road along with the one that they love. So,
right.
Do you have any other final comments? I mean, we're going to close our time off together, but anything else you'd like to share with the listeners today? Yeah,
I think, making sure that as you're reaching out, be it, with our agency or any other agency, that you do your due diligence, you're following up, you're making sure that the provider that you choose is working for you and with you. I think there's a little bit of a misconception sometimes where it's like, I don't really love, the service I'm getting, but, they're the provider. And it's important that that's just not how that works, right? It really needs to be that person is of service to you, and that you feel comfortable and confident in the work that you're doing with them. And it's your choice. It's absolutely your choice. Yeah. So what do you do if someone is in a situation where they're meeting with someone and it just doesn't feel comfortable for them? Yeah. So I think the first thing is really advocating for yourself, sharing that, hey, this may have happened this way or that way. I was really hoping for this or that, just really detail specific, enumerating what your needs are and giving that person the opportunity to make an adjustment for you. Yeah. And then remembering that if that adjustment doesn't happen, you're the boss, right? Like you have the opportunity and essentially the right to choose who is in your care team. Yeah. So seeking out other options and not being afraid to pivot if you need to. Great. Yeah, that's a great perspective. And that's what we talk about a lot, is taking control of your own mental health. Absolutely. That and when we talk about medications, I really encourage people to know what the medications are, that people should know what medications they take. Right. And they should know why they take them, what they do, what the side effects of them are. Yes. And then when you go into a psychiatrist's office, they're certainly the trained professional, but you need to work as a team with that. Right. And say, look, this is how this is making me feel. Yes. And that is how you're going to be successful. Absolutely. Is to have a mental health team that works together with you, and you're kind of leading that team. Right. And asking questions too, right? And so oftentimes that's another thing I hear is, my doctor gave me this. Yeah. Versus, it should be a conversation. Exactly. If you're not comfortable yet choosing a medication or any medication at all, just say, hey, what are my other options before then? Yeah. And recognizing that, again, like you're driving the car, right? Absolutely. Absolutely. And if you have a doctor that won't include you in that won't share that information, is put out when you ask questions about that, then you might consider finding one that is more of a team player. Absolutely. That understands your important role in that. Yes. Right? Absolutely. 100%.
And well, before we finish up, for those who might need mental health services in the Houston area here, give us your locations, your contact information, what information that they might need to know.
Yeah. So we are currently in 4 locations. We're in Spring, we're in Cypress, Katy, and Memorial. Our website is www.greaterhoustoncounselingservices.com. Our direct call-in number is 832-717-7166. And we do have administrative support through our client care team from 9 a.m. to 4 p.m. Monday through Friday, and then on Saturdays from 9 to 12 p.m.
Okay. Thank you so much. And thank you so much for visiting with us, Christina.
Yeah, thank you.
I really appreciate it. And thank you to all who joined us here for A Mental Moment. Be sure to follow or subscribe to our podcast to hear about new episodes as they're released. And until next time, remember, there is support. There is hope.